Okay, and for the last presentation of today, I'm delighted to welcome Andrzej RYS, who is the Principal Scientific Advisor at European Commission's Directorate for Health. Andrzej has spent a good number of years at the European Commission in critical roles, including as the Director for Health Systems, medical products and innovation. That was in his previous capacity, just before he assumed the current role of the principal scientific advisor. And we have heard earlier about the list of expectations towards what European policy can address. The very last talk also ended up with the medical device regulation and how it should enable innovation better. So we're greatly looking forward to what Andrzej has to share with us. We deliberately asked him to spend the whole day with us, listen to the talks, and then draw conclusions which are as actionable as they can be, of course. We will devote more time to that, to the way forward tomorrow. But Andrzej's talk today will definitely serve as massive food for thought for that reflection.
Thank you, Paweł. Thank you for the invitation, and good evening, everybody. And I promise I will not use my 1 hour. Don't worry, guys. You know, Ines provoked me to explain the MDR story. You are completely right, but maybe I will have one small sentence about this. I will try to share to my presentation two kind of different slots. The one will be more formal, telling you what's up in this area in the health policy in Europe, and the second one will be more about reflection about the day I have chance to watch today in the kind of, as I promised Miriam, the kind of connecting dots, because the many dots, they are already there, and maybe we can try to see how we can connect in the end of this great conference. If you I know you are not, but it's good to remind myself also that this week is a mental health week. My commissioner made very strong statements supporting, this moment of the kind of year. But a number of years ago, I am 18 years European Commission. So I remember that when we started discussing, that we have to do something in mental health, it was maybe 12 years ago. It was really difficult. It was not in the agenda of any kind of political agenda of many member states. This was hidden problem. It was something people should speak for employers. This was not fancy issue to discuss. So simply, I remember we started with a kind of big conference here in Brussels, because the only thing we could do was just do meeting with stakeholders, with different people. It was opened by the former Prime Minister of Norway, who also explained his depression case and how he went through the difficult time of his life, and then many other issues. So we continue with the mental health compass, was way to gathering evidence and so on and so on. But of course, what's happened in the last few years is we have this special agent, of change, which was the COVID. Already today, you refer a number of occasions to COVID. COVID brought us to telemedicine, use of, I think some of you said, the percentage of telemedicine services in psychiatry, raised a lot, the many new phenomena like cross-border also. Therapies and advice going, which was unbelievable, for before COVID. We have also mRNA development. We have vaccines, coming with. We heard today morning about the anti-melanoma vaccine, personalized and so on because of mRNA. We learn how to develop this kind of new products. But also just last year, my president, she announced that we will invest also a kind of our political capital into this field, because we learn debating, the future of Europe, that the people, especially young people, call for actions in the mental health. This was also to me as the one who was going to those meetings, quite big surprise, because I remember I am a radiologist, I am not psychiatrist, but I'm also public health specialist. So I remember that this to discuss mental health, especially with young people, was almost not possible many years ago. It was not almost unknown territory. You know, for politicians, it was difficult to discuss. For young people, simply this was not simply not existent. So I think it's a great change. So most probably kind of generation of people, they really are closer to not only because they feel they have a problem, but also they may hopefully will change also the way we see the problem. You know, we see this in numbers that in the Eurobarometer on mental health we did last year, we showed that the 46% of citizens in the EU has emotional and psychological problems in the last 12 months. So it's a really big number. So it's also showing that people kind of feel, and you can find these reports in so-called country profile. So if you are not familiar with this issue, so here's a country profile. You go on our website, and every member state has own kind of profile, and we try to also compare them, and then it's a kind of horizontal line between the member states. So for us, you know, when we discuss this issue with experts, we did studies together with OECD, with WHO, there are a number of areas, you know, we have to think. So first, of course, is the guiding principles about the access to the effective preventions, also about the access to mental health care treatment, and of course the other important is reintegration into society and after recovery. So we decided to kind of go together with member states. So with support of member states, especially, you know, advisory body to the Commission, which is now co-chaired by Finland. We also get into very close cooperation with WHO to make sure that we are basically on the same page, that the communication not going to the different directions. And we decided to put money together, money on both policy development, but also research. There are also a combination of money from member states and the European Union, the money for so-called recovery program after COVID. So up to 1.2 billion euros is allocated to this work. So mental health capacity buildings is something we would like to do with the WHO. So there are a number of work going on now to help member states to define the priorities on national level. Of course, the European Commission, we don't run, you know, the national policy. We can help, we can support. Of course, there are also issues around the special group, vulnerable groups, migrants, refugees, children, and so on. So we hope, you know, there's this methodology which is employed, you know, which can really help, you know, across the union. Promotion of mental health prevention, early intervention, mental health problems. Of course, all issues you are quite familiar. But the instruments we use, you know, in Europe, in the treaty, we have this famous article when we ask member states to share best practices. Of course, how to do it, you need to find the tool. So we propose to go to this EU best practice portal. This is the way to submit your best practices to this and share with others. We have the joint action on mental health. This is there again the kind of cooperation between member states on these specific issues. And finally, we like to also allocate some money for the projects implemented by stakeholders in different vulnerable group, migrants, and so on. So when we go to other sets of targets, so boosting the mental health of children and young people, as we know, this is important issues, but also is a neglected issue. It's difficult as well for many member states because lack of personnel, lack of experience, lack of kind of integrated approach and so on. So like again, help. This is, as I said, specific work of the expert group on public health and knowledge building. We are allocating some money to UNICEF to help, because this agency is quite known in the way working with schools, with children, and so on. So as you see in this approach, we really try to bring everybody in this process. We have technical support instrument, which kind of build the so-called youth first flagship initiatives, helping also involving young people themselves into this process. There's also the portion of money dedicated to better internet for kids, and better and safer internet for children. The other actions, they are in those in most needs. We again define the two groups protecting victims of crime. This is also linked to the Victims' Rights Directive, which is just adopted a few months ago. But it's also through the we have also kind of special this is the Carrefour with the cancer mission, when we have also special way of working with young cancer survivors and really try to take care of this group, of course, with a lot of psychological and support. And finally, we also are building a number of support programs for other types of people, including, of course, cancer. As I said, we try also to build on existing problem, looking for the common and share solutions. Other actions, they are on the psychological risk at work. This again, was phenomena. This 12 years ago, I remember it was the British Telecom report about the mental health at workplace. It was shock for many companies, because companies simply didn't like to see or hear. Bosses were not prepared for this. Still a few years ago, 2, 3, 4 years ago, before COVID, the issues like burnout, was simply unknown to many physicians across countries in Europe. This issue really became again due to COVID. We have seen also burnout in the health personnel, which kind of also materialized, something we didn't preach in our professional life. So here we have agency which is specialized in the workplaces and is helping also with the implementation of this through the special EU-wide campaign in this field. Again, the other package on the reinforcing the health system and treatments. So here we would like to put more money for the interdisciplinary training programs. Again, we strongly believe it's important to bring many health professions to the table. Technical support for the reform. This is other instrument we are using in the European Commission to help member states to go ahead with the reform. So if you cluster, few countries, you can really build something together, learn from each other. And often in the politics, I was also Vice Minister of Health, so I know how it's important to get the peer support as you do your peer-to-peer work. And finally, data collection to make our policy data driven also in this field. We don't like to leave this without see the change. And finally, the stigma issues, is again big problem. Here we have this special group I mentioned, which is co-chaired by Finland, which is really trying to develop the guidelines for member states how to deal with this problem. Again, sharing best practices and against joint action as the instrument of cooperation. And the last actions, they are linked to the global agenda of European Union. The money given to the Red Cross to support the psychological support for people displaced from Ukraine. You know how difficult is the situation and how much support is needed. But let me now go to the second part, which is also, I think, quite challenging, for you, and leave you my thoughts with you. I have still a few minutes before dinner. So when you see this list of action and list of recommendation which was proposed today, I don't think we miss a lot. You know, there is of course questions. You know, if I may advise, we have change in the kind of politics in Europe. Election is coming in the European Parliament in a few days. So of course there will be new setup in the European Parliament. So I think it's important to keep this agenda on the European Parliament radar. And I don't think it's difficult because now the topic is known. And of course, you know, but from known to do, it's not always easy. But I think it's a good news somehow. So we'll see what will be the new structure in the European Parliament, if the separate health committee will be finally funded, to be decided, to be seen. I think in the second half of July there will be first session of the European Parliament. So also it'll be good to see who is in the Parliament, you know, with whom you can continue to work and so on. Advice: new commissioners coming in place most probably in November usually. So we'll see how this can set up. So. But the rest, I think, beside the year of mental health, or which is very much often in the heads of European Parliament, or kind of topic high on the political agenda, I think this is already done, and I think you can click the box. Now it's more to deliver. I know also that you are working hard on the health brain action. I think will be this special discussion working group on this tomorrow. So there's also great achievement because there are already some allocations. We need to again engage with as many countries as possible, as many different partners as possible. The other things which I think is intriguing is the way we will continue to work on the biomarkers, but also on digital markers. I think it was discussed in the last session about digital markers, and then of course how we integrate, the both approaches. So I call this three pillar approach, which also we have to continue to discuss with regulators. We have pharmaceutical, digital, and also of course we have medical devices. And speaking digital, I mean also data. And I think our regulators, speaking about European Medicine Agency, but also by US FDA, or recently also just yesterday or before yesterday, British agency published quite important paper about the regulatory field in the area of medical devices and pharma in context of mental health. So I think that there is quite also watch in the regulatory boosting regulatory field. But I think it's important to see how those things can work together. And I think Ines presented something which I refer to a small anecdote, but many years ago, one of the president of European Psychiatric Association came to my office and asked me, can you explain me how it's possible that we authorize medicine, or EMA is authorizing medicine, and at the same time we are using psychotherapy? How we can connect those things, and this was before digital health era. So I think most probably there is a way to do it. And I think you showed today in your presentations, it's a new approach, but I think the integration between those pillars, data, medical devices, and pharma, I think is a challenge, and EMA and also US FDA is kind of in this loop, but we are not yet there. I mean, this is coming. By the way, there's a call now by innovative health initiatives about digital markers. So I think it would be also maybe good to have a look on this. Same for the real world data. This is agenda for regulators across the world. We are discussing this. We have a number of meetings. There's a lot of course, still questions how to do it. What is the right way to go? But also we should not forget in our proposal for pharma regulation, the so-called pharma package, which is basically shaping the future regulations, hopefully for next 20 plus years. We made this also as an issue, so there is now an agenda. We also put something which I hope you like, I mean, at least some innovators like, sandbox, regulatory sandbox, which allow to be kind of flexibility in the way innovation is set up. So basically see the possibility for some innovation, if I may say, regulatory innovation. So there are some new things we hopefully put rightly for the future, but of course we still have to wait for the final agreement in the Council and Parliament. The other point is, which something we also should not forget, we have partners in Europe. I think it's important for you to connect to them. I mentioned two. One is the Elixir, which is the network of, it's difficult to put this very in simple way, but Elixir, this is about biostatisticians, about the data setups, about the cooperation also with through biobanks, it's cooperating very, very closely. But I think there's a huge experience there, a lot of also training materials, availability of them. This is in 22 or 23 member states already. But again, I think you may connect to them because today you effectively use examples of cancer research, but I think there's also good is to use this as a way to support your work. Genetic initiatives, so-called 1+ million genome project, is already set up. Again, 23 member states are already in, so it would be also good to connect to this world. There's also questions about the other initiatives which is already on the, if I may put on the market in EU, is the European Reference Networks. It was discussion, before I left the co-chair this group that to establish new network in the rare diseases of mental health. It's not decided, but I think it's something which is kind of left without decision. But maybe it's good to keep eye on this concept. If it may come back in next years. And finally, about the regulation, because you showed this, some of you during today showed this quite difficult, steps to get from through regulations and authorization of the market, and then other steps. So there are also some good things. Emmanuel mentioned about the European health data space. We are both paddling in this field, different ways. He's implementing, concepts, building up the kind of bridges to the real world. I was the ones who co-designed the whole system. I know that it's very ambitious, but at the same time, I feel it's really going to change our way of doing many things under conditions they will be able to implement. Of course, it's not the first time in Europe we are having very ambitious target, and of course we have to do everything to deliver. The good news is, this is maybe I will just give it a bit optimistic to Manuel last word about this, that it's complex, is difficult, but I think first time in the history, to my knowledge, we have the roadmap and the kind of map, way we have to go with our ships, with our boats. Maybe ships maybe is not the best, because you can combine, make the relations to the ships. But our boats, at least we know where we like to go. There are navigation points, there are checkpoints, there are legal frameworks, which hopefully we have with data management, with the relations with patients, relations between the healthcare providers, data holders, and so on. We have AI Act, which is trying to solve difficult problems, the black box, which Manuel mentioned. I heard you, is not possible, but at the same time, health was seen as by regulator as a high risk territory, most probably rightly so, but of course implementation will be quite challenging. We have, as I already said, regulators on board. They are really working hard. We have the EMA published very interesting AI report, what they would like to do in drug discovery, in the clinical trials. There's quite ambitious program. But also we have national implementation coming to the next phase when we are speaking about access to market. We have DIGA project in Germany, which is kind of flagship for the authorization of use of digital product on the market. Most of them, 60% in psychiatry. So Ines, I heard you about the no third kind of competition. The problem is that the route we propose, you know, so DIGA is proposing of finally also Belgium authority or French authority, Austrian authority, Danish authority, hopefully will pave the access to better products. And I still believe in the concepts that better money, how is in economy, should push out the worse money. So I don't know, is better money is replacing worse money? Yeah, that's correct. Yes, or opposite. So I think it's important to find this way to go. And I think investors also, as I always tell to them, if they ask the question, you know, when I am in academia in Oxford, so it's a bit easy to say this. When I ask me, you know, what is the prospect? I said, you know, the problem is that you investors, you should be patient, because the healthcare is very regulated area. Whatever you do, whatever. If you are a profession, you have very big complex, become the psychiatrist. If you do medicine, it's very complex to get in the market. This medical device is same. And of course, you have to predict much more time than you do for software, you know, as just, you know, for the well-being app. And I will leave you with last thought, which really something I am reflecting also in my research in Oxford, that most probably we are now moving. This most probably this is not. I can put the research and five euros on this. It's a moment that we are moving from the kind of concept of personalized medicine to the more concept of data-driven medicine. You know, there are so many data now in the point of care, in the moment of decision, that my worry is that, you know, the kind of personalized idea, which always we thought would be the kind of group of targeted diseases or patients, it's a little bit different moment. Some people say this is deep medicine, but let's leave this, you know, with all kinds of theories around the future. I think we have future dinner soon. So like, thank you very much for your time and this great day.
Right, thank you very much for this magnificent overview of the European Mental Health Initiative, of the regulatory context, but also for giving us quite a few threads to follow in very concrete terms, be it on data, be it on genomics. I think this is all very much appreciated. Now, conscious of the time, I will ask but not insist on the questions. Of course, if we still have the strength, the stamina, and the enthusiasm for discussion, I would. Well, the dinner is yeah, I mean, no, there is a dinner as well, so we can discuss. The online audience will unfortunately have to be spared of that. So maybe last look around at the room. Yeah, Veronique, please.
Thank you. Sorry, thank you very much, Andrzej, for this overview. I was thinking about all your slides where there is all these initiatives, and I can't help thinking that we should have a mission for mental disorders and mental health. So we've discussed about that last year, but it was not ripe enough. Of course, there are elections and there are a lot of things that are going to happen, but can we try to work towards having a mission for that?
No, I don't know what will happen with the mission programs as whole. As you know, we have now new program which is for 2025 to 2027. So we should use what we have. There will be new kind of political and financial cycle in planning. One of course the issue will be the evaluation of what missions achieve. You know, if they deliver what they ask to do. So this usually in the commission, knowing this my 18 years, I think I will be retired most probably when this discussion will be going on. But my kind of knowledge tells me that there will be assessment, you know, of this what's happened. This was new tool. I mean, it was never used before. But I think, you know, if I don't know, cancer mission or other missions delivered, you know, maybe there would be appetite, you know, to establish new missions. So as I said, the mental health is very top of the agenda. We don't have many speeches of our president when she announced quite specific policy agenda. She did this twice. It was the cancer in the beginning of this commission, and the second time, you know, more than a year ago, when she mentioned mental health. So if I may say, you know, from the high level, somehow, if I may put, not in money term, but in the political, the policy level, this is quite already high. So I don't think the door is closed.
Excellent.
Thank you.
We will leave it there on this positive note. Of course, it will take a little more than our good intentions and instincts to produce a mission on mental health. But as Andrzej said, the elements are in place for this to happen. So fingers crossed for how it will be addressed in the new term of the EU institutions. Andrzej, thank you very much for the talk we have received from you today, and a big thanks to all the panelists during this immensely rich day. I assume, Marion, that I can invite everyone to...
Yeah, so just want to...
Or would you...
Yeah, this is me, sorry.
Oh, Fred, yes, please.
So just a little announcement that dinner will be at 7:30 and will be the same place as yesterday. And then tomorrow we'll be starting at 10 a.m. with the day forward.
Okay, so big thank you to everyone, including our online participants. We will come back tomorrow. Thank you so much.